Hi, this is Dr. Castanet. In a previous video, I explained the importance of the low back muscles, how muscle atrophy and weakness correlate with chronic back pain, and how you can reverse that over time by strengthening your back muscles on a daily basis. So first I want to show you some images to show you the anatomical problem in the muscles that we're speaking of. And then I'm going to show you briefly an exercise to do for the low back muscles. So here we go. Okay, so this is a cross section of your low back. In other words, if I take your vertebrae like this, with you, I have my fingers holding the back of your back, and the front part is the body of the vertebra. You can see the yellow spinal nerve roots exiting between the holes. If I was to turn this, and by the way, your abdomen would be in front to the left, and your back where my fingers are. So if I was to turn this on end like this, so you're looking at the spine from the top down, and then I rotate it, so this picture, sorry about that, I'm trying to manipulate this while I'm holding the camera. So this picture now is looking at the spine from above down. This down back here is the back, and over here is where your abdomen would be, and your head would be this direction, and your feet would be down that direction. So this is a cross section, and I'm going to line this up adjacent to the MRI image here. So in this case, I'm going to superimpose it just like this. That's what we're looking at. Now, if you, I'm going to move this just a little bit. You see the yellow circled muscles? That's where they would exist on the vertebrae. And it's those muscles specifically that atrophy in the case of chronic back pain. What's critical about those muscles is that instead of the other muscles in the low back that cause gross movements, such as when you bend over and bend backwards and sideways and twist and all that sort of stuff, these little muscles, their job is to span between one vertebra and the adjacent one above and below, or the adjacent two vertebra above and below. And they're important in the very fine coordinated movement between the individual vertebrae so that they maintain stability in a way that's functional and not and safe, and protects you from injury to the low back. And as a result of the stability function and the physiologic function they provide, they prevent pain. When you have back pain, it's more common that you have atrophy of the muscles. Now I'm going to put this bony model down for a moment, and you can see the yellow circles where the muscles are, both sides. This is the vertebral body. This dark material here is part of the disc. This whiter material is another part of the disc. And now I'm going to show you some images that show you how these muscles, instead of being dark, which shows you that the muscles are fine, you see a little bit of white there, very little, but this is considered pretty good in terms of the muscle mass here, with an absence of fatty infiltration here. As these muscles weaken, they atrophy or get smaller, and then this space becomes infiltrated with fatty tissue. And the more severe the problem in the muscles, the weaker they become, the less functional they serve their role, and the more pain you have. But this process is reversible with several exercises. You can pick one or more that you do on a regular basis. And if you reverse this process over time, your back pain will get better and better and better. And I frankly can't think of another treatment where the back natural history, and pain gets better over time instead of worse. So strengthening your back is a fundamental approach to improving back pain. Of course, you may know from other videos that my other bias in terms of the way to treat these, and I think these two approaches comprise the most beneficial means to treat back pain, is to decompress the back, because in other videos I explain how over time your back gets compressed. That's why we lose height. Discs can collapse, bulge, they can pinch nerves, the collapse can cause pain of the joints, etc. But let me go now to another image, and I'm going to show you these muscles when they are mildly, moderately, and severely atrophied. Okay, so this picture, or this image, shows people with atrophy of the muscles here. The circles here are the same area circled in yellow on the previous image that I showed you. This cross-section here is considered mildly atrophied. This is considered medium amount of atrophy. You see the white there where the muscle should be, and then over here you see a great deal of white in an area that should be dark with muscle. Medicine, and I think I've explained this in a previous video, has now decided to surgically implant a electronic device with electrodes in those muscles to have you program the use of those muscles twice a day for half an hour. And they find that it's very helpful over the course of several years in reducing, in a progressive manner, the amount of chronic back pain that people have. And again, it's very promising, and it's a great proof of concept, because sometimes you can't get patients to do exercises, and so if you can make it easier, you can test the concept that it is effective, in fact, if you strengthen the muscles. Of course, there's risk with surgery, and it's not accessible to most people, and it's not even preferable because there are risks. And we know also from other research that volitional effort on your part to exercise muscles is more effective than the passive contraction of muscles provided by electrical implants or electrodes placed over the muscles through your skin. That electrical stim is typically done for muscles that are superficial. So admittedly, in this research, the electrodes are placed deep in the muscles because these are not superficial muscles. These are deep and under several other layers of muscle. Although at that level, from about the sacrum up to the up about, let's say, 8 or 10 inches in your back, those muscles are fairly superficial. They're covered by other parts of the erector spinae, or other muscles in the low back called the erector spinae. They all function to extend the back. So the take home here is that this is demonstrably significant and present in people with chronic back pain. This atrophy correlates with chronic back pain. Reversing the atrophy of the muscles is possible. That correlates with an improvement of chronic back pain in a progressive fashion, which is extremely encouraging. That then should be the advised means of treatment for almost everyone with back pain, and certainly even in those who had the implants, the electrode implants, and who benefited from it. They should have had a trial of treatment first, and perhaps they did. For most people, I think if they will do it on a regular basis, once or twice a day, every day, one set of exercise, it takes about 1 to 2 minutes to do. That's it. That's not too much to ask for a back that's under constant loads and has lots of demands put on it. I'm going to do a separate video where I show you an extension bench for exercising the low back. There are other means of exercise that are effective also, but I think the extension bench is probably the best, most applicable for most people. You can get the bench on Amazon. I provide a link to that in another video. I'll provide a link to that in the video below. Again, one set of exercise to failure until the point you feel burning in the muscles, and then you can stop at that point. Done once or twice a day, every day, and that should make a huge difference in your back pain. Hope you enjoyed that. If I can help, I'm Dr. Castanet, in Decatur, Georgia, 404-558-4015. Thank you. Bye-bye. Okay. I'm going to show you how to do use the extension bench for the low back. I'm just going to do one set. I recommend you do one set every day. If you skip a day occasionally, again, not ideal, but such is life. You can do it twice a day, one set. Do it until the muscles down here burn. You're also going to find that it works your hamstrings and your butt, and it works all the low back muscles and the erectors or extensors of your spine all the way up to the skull. So I'll do one set just so you get an idea how to do it in terms of the cadence and the number of reps that I might get. I'm going to angle it down a bit because I want you to see how low I go. Just go through whatever range of motion you're comfortable with. Don't extend beyond level. In other words, don't hyperextend your low back, but come up to where your body is fully straight, and then you flex down as far as you're comfortable. Over time, your range of motion will improve. My back feels better immediately after I do this. I think yours will too. And your back will continue to get better and better and better with this intervention over the years. And I can't think of another treatment where that happens, where the spine gets better and better and better as you get older with this. It doesn't mean your spine won't age, but maybe it won't be it's likely not to be such a painful process as you age. Okay, so I'll do it. I'm already exhausted because I did deadlifting before this. So I could have done more, but that's enough. I felt the burn on my back. That's enough to stop the exercise and benefit from it.